Hello, everyone. Hello, everyone. I hope you can hear me here. I have to say I'm very delighted to welcome you all here to the Department House for this momentous day.
Obviously, we're launching the National Travel Health Action Plan here today, which I know marks a culmination of huge amount of work across the sector. When planning the launch today, we had no shortage of people wanting to speak today, but I think we can gather a range of people here to do real-time justice and who will recognize their cases. So firstly, I would like to introduce Helen Hutchinson, who is a poet, traveller, and founding member of Planet Point. Her poems express a sense of pride, travellers feel further ethnic identity and cultural heritage, and the bittersweet memories many still hold of a life of the we may have heard her work last night on Oliver Leary's poetry program on RTE Radio 1, and today Helen is going to read her poem, Not So Strange, which is included as a part of this reaction chat. Thank you.
Thank you. Just before I read my poem, please just have a little reflection, maybe just small silence for something that was very dear to us, and I should have been here listening to the running fade. Please. Hero legacy. Not so strange. 40 years behind our time, that's us travellers kind. We are a suppressed ethnic minority group, Irish people to deny. They don't like where we come from. As we were born on the roads, try to make us live their life, live our life, we tell them, or so they're told. Most young travellers with just basic skills keep us down on each trip. A few got lucky and had a life. The rest still struggle with a terrible life. Traditions stay and traditions stay. As some young travellers try to obey, incognito is now what you do for a young traveller to get by. To gain the main system, yes, that's true. You have to deny that you are you, but you are you.
Now we have Martin Green, who is Chief Officer of the Agency Community Healthcare East, and who will chair the National Travel Health Action Plan Steering Group. She will introduce the goals and the actions of that. Thank you very much.
Good morning, everybody. You're very welcome, and thank you very much. It's a great privilege for me to be here this morning, and thank you very much for that very appropriate beginning and tribute to Shivani. She is very close to us all this morning, and we miss her terribly. Anyway, I'm going to start and just ground where we are today in a little bit of policy in terms of where we've come from. So just in terms of our origins, the All Ireland Traveller Health Study 2010, we assessed the year with us this morning, which is a great privilege as well. Based really the set of context in terms of what we're trying to do today and why this action plan is really important. As did the National Traveller and Women Inclusion Strategy and indeed the Programme for Government. So all of these outline very clearly the health status of travellers, the difficulties they were experiencing, and the situation that prevails. So if we look at the population of travellers, and this is important, this slide, if we look at the All Ireland Traveller Health Study, it estimated the traveller population in the country to be 36,000 approximately. The 2016 census estimated somewhat lower than that, at 30,000, nearly 31,000. And the most recent Department of Housing and Local Government Heritage 2021 estimated that there were 11,680 traveller families. And given that the average family size is about 5.3, according to the 2016 census, this is the equivalent of about 61,000 travellers. I think this is important when we look at the status of travellers, because that number would fit comfortably into Croke Park. And I don't believe it's beyond us to actually ensure that the health of that population improves. And that's why I think we need to keep that number in our minds when we're looking at the health status of travellers today. So if we look at the 2010 study, we saw very clearly that for all causes of death, travellers experienced higher mortality than the general population, and the gap between travellers and the central population has grown in the last 20 years. So for a traveller infant mortality is 3.5 times higher than the central population. For men and women, their mortality rates are poorer. And when we look at why this is, we know from the study that there are very clear reasons why this is the case. The social determinants of health refer to things like their environment, their living conditions, their income, their education. And for all of these social determinants of health, the traveller experience is poorer. They have lower educational attainment, poorer housing, poorer infrastructure. And there is a lack of awareness around their cultural identity and their specific needs. When we look at the findings from the Travel Health Study, 41% of travellers had complete trust in healthcare professionals. 82% of the general, that compares to 82% of the general population. 53% of travellers worried about experiencing unfair treatment, and 40% of travellers had concern that they were not always treated with respect and dignity. 50% of travellers had concerns about the quality of care they received, and 50% experienced discrimination in their daily lives. Now, we know from health research that discrimination has a very significant impact on a person's self-esteem and indeed on their health outcomes. And indeed, when we talk to health professionals in that study, service providers, 66.7% of them agreed that discrimination against travellers was experienced in the health service. So it wasn't just the experience of travellers, and this is important. It was also the experience of healthcare providers, and the travellers did experience discrimination. Unfortunately, from 2010, we know from other studies like the ERSI report in 2017 and the Mental Health and Office report in 2018, and in terms of recent data from COVID, that this experience hasn't, the rhythm of that experience hasn't changed greatly actually. The experience in terms of COVID was that travellers experienced higher rates of infection across all age groups, and adults experienced greater hospitalisation relaxation, greater levels of ICU admission, and deaths when compared to the proportion of the central population. So, before we go forward into the detail of the plan, I want to state that this is really important, that the values and principles that underpin the current experience need to be addressed in the development of the plan. So the values of community development and the principles of community development need to underpin what we're doing in terms of this National Travel Health Action Plan. The values of social justice and solidarity, of human rights, equality and anti-discrimination, of active participation and empowerment. These are really important. They're not just tokenistic, they're really important in terms of how we do our business and in terms of sustainable development. The principles of respect, an intercultural approach, mainstreaming and targeting, evidence-based planning, collaboration, harmonisation, and intersectoral collaboration. And as I said, many of the determinants of health are broader than the health service, and they have a very significant impact on health, including our education, our housing, and our income. I'm not going to read it, Kathy, so I'm not going to read this whole slide. But the vision for the health service is one in which travellers can achieve their full potential in respect of their physical, mental, and social well-being, and where traveller well-being is valued and supported at every level. The vision is underpinned by one in which traveller families have equitable outcomes in health, resulting in healthy and resilient traveller community. And the traveller community have a very particular culture, and that needs to be respected and understood. And travellers need to be involved. We know from the projects we have in place that where travellers are involved and participate fully, we have actually more successful implementation. So we can see when we look at the original study, about 84% of travellers got their information from other travellers, from peer educators. And we found that in COVID, again, over 80% of people got their information from peer educators through our traveller primary healthcare projects. And indeed, we found our primary healthcare project workers were critical to success in improving the uptake of vaccination and IPC guidelines during COVID. So that's really, really important. Equally, I know from my own area, in Southeast Wicklow, and I think some of our primary healthcare project workers here today and our coordinator, and when I go out to speak to them, they know exactly the level of immunisation in the traveller population they're working with. They know the uptake of screening, and in actual fact, where we have implemented those projects, we know that the uptake of vaccination and screening has improved. And we can cross those barriers to access that we have witnessed. So in terms of a framework, the elements of these framework are critical to our success, as I've said. And they are not mutually exclusive, but rather interdependent on each other in terms of implementation. And I'm going to talk through two particular elements. I've talked about the determinants, but we talk about take targeting and mainstream. When we talk about mainstream services, we're talking about ensuring that our mainstream services, our health services in the country, are appropriate. In other words, that when a traveller goes in, they should expect and experience the respect that they are entitled to. And they shouldn't be afraid to ask questions. And the language and communication should be just such that they can understand. And that's really important. And then when we look at targeting, when we look at the inequality that exists between the traveller community and the settled population, we know that there are specific projects, like our primary healthcare projects, like an antenatal project we have run with Paddy Point here in the east, and it targets the education antenatally of young traveller mothers. These are specific projects that are required to address the inequalities that exist. So those two terms are important as we go forward with this plan. So again, we have quite 4 goals and quite a number of actions and objectives. 4 goals, 9 strategic objectives, and 45 actions. So it is quite a broad plan. It is comprehensive in its nature, and our expectation is that every community healthcare organisation, and we have 9 of them in the country, will develop detailed implementation plans to address these 4 goals, objectives and actions. And our expectation is that those detailed plans will be worked through in 2023. I'm very glad to say we have got additional money for 2023, 1.3 million, which is really welcome. And that will certainly help us stabilise and invest in the travel health infrastructure that exists in the country, and also help us to develop particular areas. And they vary throughout the country depending on the needs, as said earlier. So in terms of implementation, there will be an implementation group set up by the end of 2022, so before Christmas, and we do have additional resources, as I said. CHO stands for Community Health Organisation, and the expectation is that every CHO will have an implementation plan, and we have some resources and investment put to that already, and that will be completed in the early 2023. And then those will be collated into a 5-year implementation plan nationally. Before I finish, I want to thank you people, and I know there'll be thank yous at the end, but as I might not get a chance to speak to you again, I particularly want to say thank yous. This action plan is a bit like a cookbook that exists in my house. It's an equal opportunities kitchen, so there's a lot of fingerprints on it. So I just want to start by thanking the people in here in the department, Siobhan McCardle, Jim Walsh and his team. They have been extremely helpful and supportive in terms of developing this plan. My colleagues in the HSE and my boss, Conan H, here somewhere, and the CEO also gives his apologies, Stephen Mulvaney. He was supposed to be here today, but unfortunately got pulled away to another meeting, but sends his best regards. Joe Doyle is there in the audience right in front of me, and his team, Bridget Perkins, Michelle Curran, and Eva and my own team, who have been absolutely critical at getting us here today with this plan. Very importantly, I want to thank all of the travel health organisations in the country. They have been critical to success and have given very significant input into this. I also want to thank our primary healthcare project workers, our traveller primary healthcare project workers. They are leaders in their own community, and their leadership has been evident right throughout the process of developing this plan. Philip Wash is here with us today again, and Philip did a very significant consultation through all the travel health units in the country, and I want to acknowledge that it's very, very important the level of input, and it has contributed to the development of the plan. And last but not least, I want to again acknowledge the contribution of Ronnie, who was absolutely dedicated her career and her life to the agenda that is before us today, and to the participation of travellers and hearing their voices. I'm going to hand over now to the next speaker, which is Claire Bridget, who you may all have heard on Morning Ireland this morning, and I couldn't have thought of a better voice to hear first thing in the morning. So thank you very much, everybody, and I'm very pleased that
Thank you, Martina, there. That was very welcome. As Martina mentioned, I'm able to introduce Mary Louise Collins. Mary Louise is here to help work in the Primary Healthcare Group Travels Project. She sat on the steering committee for this action plan. Mary Bridget, as I'm sure a lot of you know, has a long track record on traveller health and is instrumental in the development and undertaking of the All-Ireland Traveller Health Study. Please give it up for her.
Good afternoon, everybody. Thank you very much. I'd like to just say a very big thank you to the 3 ministers that we have here today, Roger Paul and Stephen Donnelly. And I suppose it's a great opportunity to have 3 ministers in one room, which is very important as well. As I said, my name is Mary Louise Collins. I'm Assistant Coordinator of the Primary Healthcare Project at Happy Point. And today, as a traveller myself, and along with other travellers today, this is a very big day for us, and very special as well. This has been there for a long, long time. This was a recommendation after the kind of the lead on it, and went to visit travel groups all around. And every single one of the travel groups around the whole country said that the social cameras was having a huge impact on travellers. And we know that as travellers, it's our own life experience, the discrimination and racism we face. Travellers die much younger, the huge unemployment rates that we have. And we know that this is impacted on travellers' mental health, but also physical health as well. So I think it's very important today to be here for this traveller health action plan. And I know people has penetrated already to Ronnie, and I know Ronnie was a huge part of the travel health action plan, and I always wanted to see it over the line. I think today is a very important day, and I think we're very sad we didn't get down, especially working at it for the last number of years. I know Ronnie since 1985. It's been extremely hard to get back to point in relation to Ronnie. I know she could run around the room today, smiling and laughing, and catching everybody, because she had that travel health action plan, and she knew the huge health inequalities that travellers face in Irish society. So Ronnie is a huge loss, but also at the same time, within a couple of months, we lost the role of Wayne as well, and he was a great sample and magnified, took the lead again, and involved in the travel health action plan as well. So the actual staff members are with this very, very much. So there are huge loss at the time, and I know the one in the room would want us all to continue and to do the very best that we can and always fight for the injustice the travellers are facing within Irish society. So I think that's what's important today. We seem to do the All Ireland Health Study in 2008. Cecily, I see here, Ronnie again, had a huge partner, and so did the primary healthcare projects and traveller organisations as well. And I know the findings were published in 2010. The All Ireland Health Study was done on travellers, for travellers, where there was huge literacy problems. Doesn't mean that because of literacy problems that a piece of research could be done in your own community and done in many different ways. And that's what we managed in the All Ireland Health Study in 2010. And I know Martina talked about life expectancy 64 years of age. Out of 40,000 travellers, between North and South, we only got 8 travellers over the age of 85 years of age. We look at government plans for plans for people that will be living longer and pensions and people working. And certainly if you look at the travel people will be planning for travellers because our life expectancy is 64 years of age. So we need to see change with the travel health action plan, and we need to see it very soon for our children, our grandchildren. We do marry very young, we have children, we have grandchildren, but it is for the next generation. We have a very young population coming up, and if things don't change for them in the future, they're not going to live as long as the general population. So there's huge health inequalities when you look at the All Ireland Health Study again. Just the other thing, we see positives out of the All Ireland Health Study as well. There was much more uptake of breast screening, surgical check within the travel community, and we really this is down to the primary healthcare projects. And I think today we should be very proud of all our primary healthcare projects, our local travel groups as well, and all the hard work that we can do. And I think during COVID, it was highlighted much more during COVID, but also we worked very hard before COVID. And we work with public health during COVID, we work more with the HSC, and we would like to see that work continue in the future. And we know the work we do, we were putting ourselves at risk, we were putting people at risk of long-term illness at home. We were all primary healthcare workers went out with very different sizes. We had to give the message about isolating, washing their hands, but that was very, very difficult for travellers out there because of the overcrowding that travellers were facing. Also maybe one tap between 5 or 6 families. So we were in a huge crisis at COVID time. I tested positive for COVID myself. I was good enough to have a house with 4 bedrooms, but we were still overcrowded with 9 people. That was difficult for me because could you imagine on a site with 3 or 4 families in one day and having to go out and use your facilities outside? And that was very, very difficult for a lot of travellers out there. So I think in the future we need to see change, but also it's to see the value of the primary healthcare projects and the work that we're all doing on the ground which I would imagine that nobody else would be able to do, and we seem to do COVID and before COVID. And this is where we're bringing up the day for frontline workers, and this payment that will be rolled out, that primary healthcare workers will avail of this payment for the work that they've done up with their lives of this, the families of this home. So I think it's again today, I'm very proud that the plan has been launched today, and I think it is a way forward, it is a step, and it's a very big step. It will take a lot of work, and it will take a lot of work in the different departments. As I said, government departments all have a responsibility, but also the travellers as well. We need to see the change within the future. Also, I'd like to thank Stephen Donnelly for signing off on the National Travel Health Action Plan. I'd also like to thank Martina for her role in it as well, and also Patty as well, and for all the other people that was involved in it, has moved on since into different jobs. I think it's really important that we thank everybody, but the Department of Health, the agency, but if anybody else, I'm really sorry, but it's such a big group, but there's so many changes, it can be difficult to get anybody in, everybody in. But at the same time, I'm really happy that it is being launched today, and it is to look at the bright future and to see travellers' health improving. As we said, I've been involved for a number of years in primary healthcare projects and travel groups and travel organisations, and sometimes people can be very good at doing reports, doing papers and everything, and probably not being implemented. So I think it'd be a great shame. I know it's going to be a big, huge piece of work, that this National Travel Health Action Plan is not left on the shelves, that we will see a better future for our children and for the travellers of Ireland, and improvement within the health of travellers who live along us. That's what we need to see, and hopefully in the future we will see. Thank you very much.
Very good, thank you so much for that excellent contribution, you're very good. Next up, we'll want to introduce our Minister for Health, Stephen Donnelly. Thank you.
Good morning, or good afternoon, all. It's really great to have everybody here today. It's my great pleasure to welcome you all to the Department of Health. The Irish state has not done enough for traveller health. It has not provided the healthcare services for the travelling community that it should have provided. I want to acknowledge that as Minister for Health. The state has not done its job to date when it comes to traveller health, supporting the travelling community, and providing the healthcare services that every member of the community has a right to. Today is about acknowledging that and beginning to fix it. We won't fix it in 1 month, we won't fix it in 1 year. Today is about accepting the reality, acknowledging that in the past enough has not been done, putting in place a plan for the future. Make sure that the services that are needed for traveller men, women and children are provided, that are provided where they're needed, that they're provided how they're needed, and that ultimately the outcomes of the travelling community in terms of life expectancy, infant mortality, healthy years lived, all of the determinants that our team has talked about, these are ultimately that's all that matters, is that things get better in a real way for men, women, children in the community around the country as quickly as possible. That's it. That's the only reason we're here. That's all that matters. I think it's very appropriate that we're having today's meeting in the Department of Health. It's important to me, it's important to Minister Fee, it's important to Minister O'Gorman, because for too long the state has not listened to travellers when it comes to understanding what's required in terms of healthcare, in terms of social care. And we're here for a reason. We're here to acknowledge that and to say that we are starting a new relationship, a relationship where we listen, a relationship where government listens, a relationship where officials in the Department of Health, this building listen, a relationship in which the HSE and our frontline healthcare workers listen and provide the services that are needed. For too long, travelling communities' voice has not been heard in terms of decision making when it comes to policy. One of the things that is important to me about this strategy, Philip was very involved in it, was that we started where the state should have started many years ago, many decades ago, which was listening to the community and asking the community, what do you need? Not what officials or politicians or healthcare workers think these things. What does the community need? What are the community saying they need? And this plan, quite rightly, comes from that space. One of the reasons we're here is Missy Collins and I were at a Women's Health Conference not that long ago. And we talked at some length about the promise that's been in place for many years for a Traveller Health Action Plan. And Missy walked me through the years that have passed since that promise was made, and the fact that no such plan has yet materialised, and that no such money had been allocated. And at that conference, I made a promise to Missy. I made a promise that this government would deliver on that promise, and that we would get together quickly with the Traveller Health Action Plan that so many people here have worked on. I then met with Abby Point and Missy again. First thing she did was remind me of that promise, and that wasn't too long ago. Actually, that was earlier on this year. Mary Butler, Minister Field, Minister O'Gorman, and myself were absolutely determined that we would make good on our promise and on the state's promise to put this plan in place, and just as importantly, to make sure that there's money behind it. And we have that here today. We have the action plan. We have money behind it. And as Missy and I were discussing just before we started here today, this is just the start. We'll be developing plans with the CHOs. We will be stabilising the primary care projects that are in place. We will be expanding those projects. There used to be 14, is now only 27. We're going to stabilise the projects we have. We're going to build them back up. We're going to turn short-term money, which is what a lot of these projects depend on, into recurring funding. We're going to expand them. We're going to build on them. We're going to put in place the kind of policy infrastructure that is needed to make things better and better. We're going to be putting ethnicity markers in place. We're going to be having more training for our frontline healthcare professionals. We're going to be having ongoing professional development and education for the incredible workers that we have working around the country in these programs. We're going to make these stronger, stable. We're building out to do what we all know that they need to do. The other thing we're doing is we're funding the CHOs, community health organisations, to work with the communities to identify around the country what the priorities are. All of these are not in the plan. This plan is a start. One of the actions, for me, one of the most important actions in this plan is that the people like Martina, the people working with Martina, will be working with the communities in their areas to say, what's most important to you here now? And we all know that the priorities are different around the country. So that really is where we're going with this. The strategy today, of course, is contained within the National Traveller and Roma Inclusion Strategy, which Roderick O'Gorman is leading. This is one of the commitments within that strategy, and I'm certainly be talking to that as well. I want to thank everybody who's been involved in getting us to this place today. First and foremost, those within the traveller community who worked on this and engaged with this, make sure that this represents your voices and that you can see what you have said you need within this plan. I want to thank Martina, our HSE healthcare professionals. There's been a lot of work from the Department of Health as well in this. So I just want to thank everyone who's been involved in putting this together today. As a nation, we're doing really well when it comes to better health outcomes. I saw a report recently that showed, it's not the same in all of the reports, but it showed that Ireland now has the highest life expectancy in Europe. Depending on the report you see, we're not always first, we're first, second, or third. That wasn't always the case. We're seeing incredible improvements in things like cancer survivorship rates, the 5-year rates. We've seen extraordinary improvements in the last 20 years in infant survivorship rates and a reduction in infant mortality rates. We've seen incredible improvements in survivorship from things like stroke, heart attack. We've seen people living years and decades longer with underlying diseases. And while we are seeing things getting a little better in the travel community as well, as Martina quite rightly said, not at anything like the same. So all of the advances we're seeing by investing in better healthcare services, all of the advances that we're seeing through science and through better medicine and through better public health are not being seen in the same way in the travel community. As Martina said, the gap is getting bigger. Things are getting better, but they're not getting better quickly enough. And that is something that we are absolutely determined that we are going to address. The plan is a public health response to healthcare outcomes and the healthcare inequalities that we've seen. The plan is aimed at preventing disease, at increasing health and prolonging life. Critically, it's about addressing determinants of healthcare, determinants of health, and being very honest about the underlying causes and putting in place responses to that. And we know it can work because it worked in COVID-19. There was a brilliant engagement between the HSE, our frontline healthcare professionals, and the travelling community in terms of vaccine uptake. It wasn't always easy. As we said earlier on, there was advice coming out of this department saying, here's what the public health things you need to do. Well, if you don't have the facilities to do that, that's not always easy. But there was really good engagement, and there's really good vaccine uptake. And there's a lot of people alive today, right across the country, because of a national engagement. So we know we can do it. What we want to do now is build on that trust, build on that relationship, build on that momentum, just spread that across all the other facets of social care and of healthcare and of public health. But of course, it's not just about physical health, it's about mental health. One of the conversations Missy and I had, one of the conversations we had with Happy Point, it was emphasised very, very strongly, was just how important it is to get mental health supports into the travelling community. We know from the report, we know from the research done, that the suicide rate, which is only one indicator, but a terrible indicator, the suicide rate I think is about 6 times higher. Nobody can stop that. Absolutely nobody can stop that. There are mental health actions within the plan, there are 6, but there's more we're going to do. The programme for government commits to a mental health traveller action plan. And for me, it's really all the same. Physical health, mental health, emotional health, spiritual health, it's all part of healthcare. We need to think about it in the same way. But this plan starts with 6 actions, and we're going to go much further. It all requires money. Finalising the national service plan for next year. We got another very generous increase in our budget from government. Michael McGrath was practically sobbing into his cornflakes by the time he left the room. We did manage to get the biggest amount, but that was important. Minister Feehan fought very hard for the funding for this plan, because without the money, it's just a piece of paper. So we have €300,000 going into new initiatives around mental health. We have €1 million going into other initiatives in this plan. And as I said, we're treating this as step 1. It would be my absolute commitment that as the CHOs figure out what the individual plans are, the kind of services that the community wants, the kind of people the community wants, employed, engagement, provider services, we will fund all of that too. It's very much just a first step. One of my top priorities as Minister for Health for the last 2.5 years has been Queen's Healthcare. I'm of the view that this state has failed through its entire history in terms of the provision of healthcare for women. We have incredible healthcare workers, and some things have worked incredibly well, but we have failed. And we have not provided, and have not been providing, the kind of modern services that women in this country want, need, and every right. We're involved in a radical modernisation of women's healthcare services around the country. part of that, and I'm very happy to say that part of the funding that's been allocated through the Women's Health Action Plan is specifically to engage with traveller women and provide supports that are needed in the community, in primary health care services, and in the hospitals as well. So we're faced with a task. It is a difficult task. It is a profoundly important task, and it is one that all of us here must be absolutely determined to meet. The politicians, the civil servants, HSE healthcare workers, community groups, and the community working together, because it will only work together. Our aim is this, is that the health outcomes of the travelling community are the same as the health outcomes for everybody else. We know from the research in this plan and from what Martina was saying, that we are very far away from that right now. Not only are we far away, but the gap is widening. So this is a big task, but it is absolutely imperative. Our republic was founded on some very important ideas. And for me, one of the most important ideas in the proclamation is that all of the children of the nation are cherished equally. We have not done that to date when it comes to traveller children. We have failed as a republic to meet that idea. It is a founding idea of our republic. It is one of the most important things that we can do as a republic, is to cherish children of the nation. So my commitment to you, and the government's commitment to you, is that we are going to work with the community. We're going to work with the departments, with the HSE. We are going to invest money. We are going to prioritise what needs to be done at a political level, with ultimately one aim, which is health outcomes, mental health, physical health, outcomes for the travelling community are the same as the outcomes for the rest of the country. And then, and only then, can we say that we will have fulfilled one of the most important founding ideas of our republic. Thank you.
Thank you so much, Minister, for that. Next we have Minister of State with Responsibility for Public Health, Wellbeing and the National Drug Strategy, Frank Leon.
My dear friends, I'd like to welcome you all to the launch of National Traveller Health Action Plan. And you all believe this is a historic day for travellers and for health policy. And this is the first time in 2.5 years in the Department of Health I've seen such a packed council, so you're all very, very welcome. For the first time, we have a health policy that acknowledges and addresses the additional needs of travellers as a minority ethnic group. And over the past year, I've had the opportunity to visit traveller health projects across the country. I've heard firsthand the health issues facing travellers and seen the valuable work being done to improve access to healthcare services. The action plan builds on these local initiatives by providing strategic and long-term basis for improving the health experiences and outcomes of travellers. The starting point in developing the action plan is the recognition that travellers have the right to the highest attainable standard of physical and mental health, as it is the norm in our society. Progressively, this is not the case, as the travel community continue to experience severe health inequalities reflected in quality of life and poor quality of health. To achieve equity, we have to bring travel health to the same standard as our health population. The action plan sets out to improve the health experience and outcomes for travellers by the department, the HSE, and healthcare providers working together with, most importantly, traveller healthcare projects and organisations. This partnership approach is a cornerstone of the development of the action plan and its implementation. The phrase often used is nothing about it without development. This is especially important given the negative experiences by travellers of policies and services. The action plan provides the basis for regaining trust and developing mutual respect between travellers and public health service. The action plan recognises that the root cause of health inequality for travellers lies in the social determinants of health, most of which are outside the health system. These are the conditions that travellers live, work and raise their families. The social determinants are now more important than health or lifestyle choices in influencing health status. The Department of Health's life shift policy to address health inequality and the social determinants of health is the launch of their health and community program. I am delighted to announce that the department will provide additional funds to address the social determinants of traveller health in conjunction with the launch of their health and community program. This initiative will tailor mainstream health policy to take account of specific social factors influencing the health of travellers. The action plan acknowledges that travellers of the minority and ethnic group can experience difficulties in accessing health services, low health literacy, poor communication channels, impaired interactions between travellers and healthcare providers. And evidence shows that people who are socially excluded underuse some services, such as primary preventive care, and often rely on emergency services such as AED when their health becomes acute. These difficulties result in missed opportunities for preventative and early intervention, thereby exacerbating health inequalities. To address these barriers, the action plan adopts an inclusion health program, which seeks to change how healthcare services are delivered. And central to this, the involvement of travellers in healthcare delivery. Primary healthcare projects are an example of a peer-led model that trains travellers as community health workers. And the provision of services in a culturally sensitive manner is another feature of an inclusion health approach. I allow my colleagues, Mr. Donnelly and Mr. Butler and Mr. Corman, are fully committed to providing the leadership and resources to ensure the successful implementation of the action plan. This commitment includes the provision of ring-fence new development funding of 1.3 million in 2023, which already alluded to. And this is in addition to the 10 million that is already allocated for travel-specific health services. To conclude, I believe the Traveller Health Action Plan, it is a significant step to improving health experiences and outcomes for the traveller community. And we would like to thank the HSC, the National Social Inclusion Office, and the steering committee which developed the action plan, chaired by Tina Wheeler. I also want to acknowledge the contribution of Connie Kay, who passed away earlier this year. Connie was a great advocate for improving the health status of travellers. I also want to acknowledge the contributions of officials in the Department of Health, developing and supporting the action plan, both in the drugs policy and social inclusion unit and mental health. Finally, I want to thank each and every one of you for coming here today and celebrate the launch of the plan and today's day.
Thank you so much, Ms. Vivian. Next we have Minister for Children, Equality, Disability, Integration and Youth, Roger Moore. Thank you.
Thanks very much. Good afternoon, everybody. I'd really like to thank Mr. Donnelly and Mr. Ian for the invitation to me today to speak with you at this much anticipated and really, really important event, the launch of the National Traveller Health Action Plan. And I think we all know that due to COVID, the finalisation of the action plan took significantly longer than everybody else had initially envisaged. But the time devoted to the Traveller Health Action Plan has been put to really good effect. Firstly, in terms of making sure there was really good participation by traveller representatives in the consultation process that helped form the plan, but importantly, the inclusion of robust resourcing provisions so we can ensure that this plan is effectively implemented, that we all know that is absolutely essential. And within the interest of the National Traveller Health Inclusion Strategy, there are 42 health-related actions, but The reality is that the struggle to achieve real improvements and better outcomes for travellers in terms of health, that struggle absolutely remains. Following years of marginalisation and poor living conditions, the traveller community continues to experience higher levels of health inequality. As Martina in her contribution, she touched on a number of these, some of these really stark statistics. Life expectancy for a traveller is 11 years lower than for the general population. Infant mortality is higher, and that suicide rate is 6 times higher for the traveller community is percent. Deeply shocking statistic, but I know that is a reality for so many families across the traveller community. I'm sure for many people here who are today has been touched by that stark statistics as well. So much more needs to be done to ensure that travellers have improved access, participation and outcomes in our healthcare system, and to address the wider social determinants that impact on traveller health. And the development and the implementation of a detailed action plan to address the specific health needs of travellers, that's an action that's set out in interest. It's a key commitment in the programme for government, and I welcome the publication today of the National Traveller Health Action Plan as delivering on those commitments. But again, as others have said, it's not enough just to draw up a nice policy document. It has to be backed, it has to be implemented, it has to be enforced. And that's why I'm particularly pleased to see both the Department of Health and the HSE have explicitly addressed in the action plan how they will provide the leadership, the resources, the monitoring and the accountability structures, in particular looking at making greater use of ethnic identifiers to assist in monitoring access, participation and outcomes from services for travellers. And work my own department is doing with the Department of Public Expenditure in terms of creating quality data strategy would be really important in making sure we have that ethnic identifier used in terms of the health sphere, but also in other spheres where we know travellers' access and traveller outcomes are not what they should be. I'm really aware of the deep concern of traveller representatives in relation to the mental health crisis facing the traveller community and the devastating impacts that suicide has had on so many people. I'd like to echo the remarks of Mr. Donnelly today and recognise his emphasis on the whole of government approach to improving traveller mental health. I attended the protest a number of months ago outside of your office. I know how important this initiative is to all members of the community, and I know that the mental health actions set out in the action plan can be put into effect as quickly as possible, but I know we don't see this as the final word in terms of our efforts to address this mental health crisis. There have been significant achievements in a number of traveller health related actions in recent years, and this action plan seeks to build on those. I think other speakers already recognise the strong role played by the traveller health units of primary health care for travellers projects at improving access to care and promoting peer support and advocacy among travellers. I know other groups like, for example, the Traveller Counselling Service have been really important in providing very meaningful, very underground, very accessible mental health supports. And the importance of the work and the impact of peer workers has been recognised in enhancing health literacy and continuity of care, while also supporting the cultural awareness among healthcare staff. I think we all heard the passion with which Mary Bridges spoke earlier on, and as a peer worker, about her own role to continue to build on the strength of the peer health workers. As I said at the outset, the engagement and the participation of traveller organisations, that's absolutely crucial to deliver successful traveller enrolment policies. And in health, it's absolutely clear that the participation by the traveller community in the actual delivery of healthcare is also paramount. The social determinants approach to healthcare means that all government ministers need to ask themselves what they can do to help them to ensure that the ambitions contained in the action plan are actually realised. That again is very natural. Traveller inclusion strategy comes in, bringing together, as it does, government departments, state agencies, along with, most importantly, along with representatives of the traveller enrolment communities in a common cause to address the persistent exclusion, persistent disadvantage, and because a lot of the committee members are here with us today. The program for government commits to a review of interest and a renewal of interest, a new interest document, and working at the moment with stakeholders in terms of advancing that process, in terms of particularly making sure that the new strategy, when we bring it forward, that it will contribute to the achievements of the health action plan that we're launching today, but also that the new document, spoken about this before, that the new interest has clear and measurable outcomes focused approach. And that's something that everyone wants to see. In her contribution earlier on, Helen asked us to have a moment of silence for Ronnie Fay. I think Ronnie's impact on this document today and on the wider support of the traveller communities has been echoed in all the speeches so far today. And I know just looking at your audience in terms of your own reaction to remarks about her. So we remember her today. We recognise the work she put into this document as into so many other documents. Her impactful commitment for the human rights to the traveller communities. I'm really glad that the document we're publishing today benefited from her insight. As Minister for Equality, I look forward to working with all of you to ensure that we can achieve full implementation of national health action. Thank you.
Thank you so much, Minister, for that. Next we have Martin Anthony Collins, our singer today. Martin has a real passion for travel music and feels it's important to keep these songs alive for his children and for the future generations of the travel community. Martin Anthony is the son of James Collins, one of the last Travellers Intimates, who's featured in the inside cover of the action plan. And Martin is going to sing One Starry Night Here Today, which is the Traveller love song. Martin, thank you.
One starry night as I lay sleeping. One starry night as I lay in bed, I dreamed I heard wagon wheels a-creaking. When I awoke, my own love had fled. I'll search the highways like my byways. I'll search the quarries, the camping places too. I will inquire our love our people as they tie their tidings for signs of you. For it's many's my love with you I travel. Many's the hour love with you I spend. I dreamed you were my love forever, but now I find love you're only late. I'm drunk today, but of times I'm sober. A constant rover from town to town. When I'm dead and my sorrows ended, Molly wants a story, come and lay me down. For it's many's my love, with you I travel. Many's the hour love, with you I spend. I dreamed you were my love forever, but now I find love you're only late.
who has spoken about traveller mental health candidly in the past. He has received acclaim for his performances all over Ireland and is a celebrated entertainer and spokesperson. So, Martin, please take it away.
So, no one told me that I was going to be following that. And to be happy to hear that I'm not going to sing a song. I was asked, I was strong-armed into coming today by Frank here. So a little thing about Frank. Frank, outside of this talk here today, and I don't mind saying this, you might. He is a man who does things. He turned up to one of my theatre shows in the Hawkstad in Sligo, unannounced. You may have been the case also that it's for free. Actually funded by Mr. Gorman's department, it was during Traveller Pride Week. So I was delighted to find out that there was a minister in the audience. There was also two Gardaí in the audience as well, Frank. I don't know if that was a set-up. But it was a perfect time for a conversation though. Because after I performed the work in progress, which by the way is probably the best play that's available in Ireland right now. You can back me up with that one, right? But afterwards, the most important part of it was, because the play was actually a work in progress, it was one of the first times it was in front of a live audience. So I started writing this play during the pandemic. But he talked to me afterwards and we had a great conversation. And but it wasn't the play that you were most impressed with. It was the fact that we had an open and honest and frank discussion with everyone in the audience. Because for one of the first times in my life, there were LGBT people, there were non-nationals, there were people in the political realm, there were Gardaí, and it was a perfect opportunity to talk about things within my community, but also how they interact with people outside the community. So I was almost like a cultural nexus point, like a dartboard basically, taking questions from everyone and anyone. And there was something beautiful and transformative about that conversation, Frank, because you were crying. And the mascara was streaking. I had to hold you close. The play itself is actually about an LGBT traveller who returns home on the day of his grandfather's wake. It deals heavily with suicide, depression, and mental health issues. And while we can have all the jokes and laughs, it's important to have those. And even in the play, during the funeral, there are the lads around the side of the house who are laughing. And one of the lines is, the laughing men are on the side of the house. They laugh because they don't want to lower the swollen throat, choked emotions. That's what men do, unfortunately. We hide our emotions. We don't know how to deal with our emotions. So I wanted to keep that within the play. Today I want to talk about the fact that I, along with, I'd say, every other traveller in this room and across the country, have been affected by suicide. That's the reality. 6 times more likely to take our own lives. That's the reality. What's also a reality is that we have allies outside of our community. For one of the first times in my life, I've seen actual change within the government. No disrespect to the government past or president. Especially that president, because that's the president. And I don't know about you, but Stephen Donnelly looks like a control puppet of shapes towards it. But I've seen real change, and not just within the Department of Health, because this is fantastic. And I stand here on the shoulders of the giants of the people who are working. I feel almost like a fraud, taking this space and talking about the hard work that's been done to bring us to this point. But I will be one of the recipients of the hard work. I just want to say that outside of the Department of Health, even with Minister Catherine Martin recently, with Creative Ireland, Tanya Ganotti, and they hang on a second because Reach will kill me if I don't get the right people mentioned, because this is a political thing. You have to say who was really involved with it. The Department of Health, I hate the long title, but I just need to shorten that. The Department of Tourism, Culture, Art, Gaelic, Sports and Media. Creative Ireland, co-funded by the Department of Health, supported by the National Social Inclusion Office and Mental Health and Wellbeing Agency. The reason I mention this is, for the first time, we're seeing a means of healing, not just in service provision, not just with doctors, GPs or psychiatrists, but within the arts. A means, a mechanism to express ourselves, which is one of the fundamental ways for us to overcome any anguish of the whole inside. And at the end of the day, that's the cause for it. Thank you so much, and thank you so much to everyone.
I would also like to acknowledge David Walker today, on your contribution to the I would also just finally like to extend a strong thanks to those who have contributed to the launch today. A huge, massive special acknowledgement for Bridget herself and agencies such as Good Office. I also want to thank colleagues in the press office here in the Department of Health and those in corporate services and our team in the Drug Policy and Social Inclusion Unit who all have been instrumental in today's launch. I believe now there will be some interviews with our speakers and I expect to see thank you all here for coming today. Despite the bad weather we've been having, I hope you all managed to get a warm cup of tea again. So thank you. Thanks so much.